Hey, everybody, Saul Marquez with the Health Matters Podcast. I want to welcome you back to another episode here from Las Vegas Convention Center at the Health 2023 meeting. I have Dr. James Wantuck with us. He is the Associate Chief Medical Officer at Accolade. Dr. Wantuck manages a large, growing group of physicians, therapists, and clinical operations staff while working with patients daily. He's a board-certified internal medicine physician who co-founded Plush Care in 2015 and grew it to over 200 physicians, offering high-quality, accessible, direct-to-consumer virtual care. James, thanks for joining me today.
Super happy to be here. This is great.
And really, just before we dive into the work you guys are doing at Accolade, talk to us a little bit about what inspires your work in healthcare.
It's been a long road. Medical training takes a while, and my journey started earlier than that. I think I got into medicine growing up. My father had a bunch of operations. He thought that doctors doing it were just really cool. He just was so impressed with what they could do for him. And I kind of latched onto that and obviously did well in school, thought that was the right path for me. And I wanted to help people. And I wanted to help people in a big way. And I think I knew from early on in my medical training that I wasn't just going to be, not that it's a bad thing, but I wasn't solely going to be a clinician seeing one patient at a time. I really wanted to help people in a bigger sense.
Love that. Thanks for sharing that. Such an inspiring story with your dad and everything worked out. And then you took it and now you've taken it to the next level. So you created a company and now you're with Accolade going beyond the bedside. A hot topic in healthcare today is the rising popularity of weight management medication. You, in particular, you helped design Accolade's clinical protocol for weight management to support both employer and consumer members. What are you hearing currently from employers and HR leaders on this topic?
Everyone's talking, right? If you're out on the show floor here at Health, everyone is talking about GLP-1s or large language learning models. Those are the two topics that I'm seeing out there. Employers are talking about it too, because what they're seeing is that their employees want these. Their employees are adopting these, and it's costing them a lot of money. We just did a very large survey at Accolade of over 500 HR leaders, and we found that 80% of them, nearly 80% of them, thought that their employees would be really interested in GLP-1s, yet only 25% of them actually cover these medicines on their plan. So there's a big gap there, obviously. People are after these. People are interested. Obviously, people want to lose weight. But right now, a lot of plans aren't covering them. Interestingly, of the 25% who do cover them, 99% of them say they're going to keep covering them. That's a pretty big deal. To me, that says
It's working.
It's working, or the demand is so strong that people feel like this has to be a part of their health plan.
And it becomes really a recruitment tool, a retention mechanism.
I think it absolutely is. And you see that, right? If you talk to patients, they'll tell you, I'm not going to leave my employer. Like, I can't lose coverage for this drug, this life, in many cases, a life-changing drug.
The numbers are compelling and really cool that you guys actually went out and surveyed these HR leaders on a topic that's so key. That's what I've had a chance to get to know Accolade and the work you guys do. Very much data-driven in the work that you guys do, the customers that you serve. Why is the doctor-patient relationship crucial when it comes to caring for patients, including designing a weight management program that works for their individual needs?
These GLP-1s are driving this trend, but they don't work alone. They're certainly close to magic, but they're not magic. And so you need a comprehensive program and comprehensive care to really get the most out of them. And every patient you see is a little bit different. Some it's more the genetics, some it's behavioral, some it's the setting that they live in, access to certain foods, all those different things. And everyone has a different balance. And so you want a physician on your side who's going to take all those things into account and then also help you manage the rest of your holistic health. You don't want to lose 100 pounds in isolation because it's going to affect every other part of your body, right? Your joint disease, your blood pressure, your cholesterol, et cetera. So I think you want someone really smart on your team, and that's what we offer.
That's awesome. And when an organization is able to hire in a way that represents the population, having a physician/entrepreneur like yourself that could connect the dots and help deliver these types of programs, I find you get the best results. And so really appreciate your thoughts on that. On the weight management front, amid the current medication shortage, how are Accolade and PlushCare managing the rise in demand for GLP-1 weight loss medications with employers and patients?
I think our ultimate job is to help the person standing in front of us, or virtually appearing in front of us in this case. And sometimes that involves prescribing a medication that we know is covered, or one that is not ideal, but we know it's in supply in their local pharmacy. Sometimes it involves calling up 10 pharmacies and tracking down the medicine, working with the PBM to get the prior auth approved. We have to do something slightly different for every patient. And I think we have a care team on people's side to help them get that done.
That's great. Is there that big of a shortage right now that maybe you have to ration? What's going on?
There absolutely is. I think almost every patient that we see is having some access issue related to the shortage. It's luck of the draw, right? If your local pharmacy, retail pharmacy has the drug in stock, you can be happy about that because not many people are finding it on the first try. But we hear that things are going to get better, and I'm sure pharma is
working on it,
ramping up their manufacturing as quickly as they possibly can, because these drugs are going to be a moneymaker for them.
They're a hot commodity and fascinating. And at the end of the day, it's about responsiveness, right? Responsiveness to what the market gives us and being able to help patients navigate better care.
I think that's right. These are a perfect example where the process isn't easy. Certainly not as easy as it should be. Healthcare is complicated, and most people don't think about it until they need it. And so hopefully you come to us and we help you figure out the process, everything from seeing the doctor to getting the prescription to paying for it.
That's fantastic. This has been fascinating, James. If you wanted to leave the listeners with a call to action, what would you leave them with?
I have to say, you have to try our service. Anyone can try it. You don't have to be an Accolade customer to sign up. It's available to consumers too. So if you're ever in need of a doctor visit, let's say maybe you're visiting Las Vegas, you happen to get sick, we're here for you from your hotel room. So I would say that's the best call to action that I could give.
And how can people engage with the platform?
You can go to the App Store, download the app.
Love it. And folks, there you have it. Dr. James Wantuck. For ways to get in touch with him, as well as ways to check out the app, go into the show notes where you'll be able to just click and it'll take you directly to that. So make sure you take action on the opportunity to engage. James, thanks for your time today.
Thank you. Good to be here.